What are some of the kinds of causes, medical causes, that could come out of taking, a visit to the GP?
Well, that's actually a really, really good question, because most of my patients who come in are absolutely at their wit's end. And they either come in because they need help. Quite a lot of them will have come in because they finally admitted to grandma, maybe, that their child wet the bed. And far from saying, oh, don't worry, that was completely normal, you did too. They've said, oh, you must go and see the doctor. And they come in and they're scared witless because they're completely convinced there's something really wrong with their child. So if your child's over about 5, we will do all the investigations. But highly unlikely we're going to find a problem. Things like having a urine infection. So we can pop a stick into the urine and just check it for protein to see if there's any evidence of an infection there. Having sugar in the urine. So diabetes is very occasionally a cause of bedwetting, but again, in children, diabetes is much, much more likely to be causing really dramatic other symptoms too. So a child who develops what we call type 1 diabetes, which is the one that younger children most commonly get, will often be very poorly. They'll be very tired and lethargic. They'll have lost lots of weight. They'll be constantly thirsty. And they'll be weeing a lot by day as well as by night. So there are all sorts of things you can look for there.
What about constipation? I've heard that sometimes that's part of the issue as well.
It can be part of the issue. Now, part of the problem, of course, if you've got other development problems, is that constipation's more of a big issue. But if you're severely constipated, it really can have an impact, both on bedwetting and, if it's severe, on increasing your chance of a urinary infection. That can be checked out fairly easily. The one that probably you're left with, that you're never going to be able to check out as such, is stress. And this is such a common cause of bedwetting. You know, it may well be that your child looks as if they're doing absolutely fine, but if they're going to a new school, they're nervous, they've moved house, you've kind of got over the house move, you're all excited about moving in and, you know, changing things around, and you've settled in. They may be really disrupted by it. So it doesn't need to be something obvious like divorce or bullying. It could just be stresses at school, something like that. So have a thought, especially if your child was dry.
Keeping all the different facts in mind, what age do you think that we should take our child to the GP?
I think if your child's still wetting certainly every night by the age of maybe 5, any age, if they've been dry and then stopped being dry. But otherwise, certainly by the age of 7, it's worth coming in. By the age of 5, think about it. If it's an occasional problem, if it's getting better but you're not there yet, much less likely you're going to need to. So what your GP is going to do when you go in with your child is very much going to depend on how old they are, for instance. If your child's under 5 and perfectly normal otherwise, they'll have a chat. They may want to have a little look at your child, but they're almost certainly just going to reassure you. Over the age of 5, they'll do some basic tests, so check your child's developing normally, check their urine's okay, check they don't have diabetes. But it's very unlikely that they're going to refer you on to anywhere.
What happens if you have a 7-and-a-half-year-old, say? Everything else seems normal, everything's been checked, but yet they're still wetting the bed. Where does a parent like that go for help?
Well, the first place to go is to your GP, because it's at this sort of stage your GP is going to be talking to you about referring you on to a specialist clinic. Now, the specialist clinic can look at all the advanced tools, if you like, that actually we're going to be covering in some of the other videos in this series. And there's lots, fortunately, that can be done, because by that stage, you've been dealing with this for an awfully long time. And frankly, you and your child are probably getting really frustrated. And maybe that is part of the help you can be offered, to help you to understand how this can move forward.